Irritable Bowel Syndrome or IBS, one of the most common gut disorders that we see in our daily medical gastroenterology practice. What causes IBS? It affects 15 out of 100 people. So extremely common, especially in younger people. There is some degree of gut bacterial imbalance. Chronic stress damages the gut's good bacteria. When should one be worried about IBS? Imagine living with it on a daily basis. What are the symptoms of IBS? In this video, we will dig deep into what is IBS and how we can get this problem sorted. You may have had number of tests, including blood tests, various type of scans, endoscopies, and been told that everything is normal, but you have a lot of symptoms. So this is what is IBS about, where you are troubled with symptoms, but there isn't much disease to find inside. And this is something that has a significant impact on people's working and social lives. In this video, we will dig deep into what is IBS and how we can get this problem sorted. What are the symptoms of IBS? Each patient is different because they all have different type of symptoms. But commonly what we see is repeated attacks of this cramping abdominal pains mostly in the lower abdomen or on the left side, that gets better by passing gas or by passing stool. There is change in the bowel habit. Sometimes you feel that you're constipated. At other times you're going to the toilet multiple times. And despite going number of times, there is a sense that you're not emptied properly and having to go back again and again to sit in the toilet. Feeling bloated is extremely common in IBS, feeling gassy or passing excess gas. And sometimes there is a lot of this rumbling noises which people complain about, and especially they are noticing it more when they are in quieter places or in meetings. That can also have a significant impact on their work life. So each individual can have variety of symptoms, and in some people you can have pretty much all of these mixed together. What causes IBS? Why only some people get it? The answer we do not know, but we do know that there are several factors that can influence on the development of IBS. There is something called brain-gut axis. So our brain controls our gut heavily. Stress, anxiety, depression, varying sleep patterns, shift patterns of work, and not getting good sleep on a regular basis can heavily influence how the gut functions. In some people, the colon is contracting very quickly, making them having to rush to the toilet frequently to pass motions. In others, the colon is kind of very lazy in the way it is contracting and moving, making them constipated. There is some degree of gut bacterial imbalance. Chronic stress damages the gut's good bacteria, and this can lead to a condition called dysbiosis, where there is an imbalance in the gut's good and bad bacteria. They might also have a condition called small intestinal bacterial overgrowth associated with it, where there is excess of unwanted bacteria in the wrong place. They may be sensitive to certain foods like lactose, which is a natural sugar that is in dairy products, gluten, that is a protein in wheat. And if they're consuming foods that are hard to digest, especially high-fat foods, that might also be contributing to the symptoms. So there are a variety of reasons for development of IBS. Sometimes you might have suffered from a bad bout of food poisoning, what we call as gastroenteritis, and post in this event, the infection may have left your body, but the gut may not fully recover, and you can have the effects of these post-infectious symptoms of loose motions, abdominal cramps, bloating for considerable period of time. One of the questions which I get asked in my medical gastroenterology practice now and again is, can my IBS turn into cancer? Getting concerned about colon cancer is understandable, but I can reassure you that IBS will not lead to cancer. because IBS is not causing any disease in the gut and there is no damage to the intestines that can lead to cancer. However, you cannot ignore certain symptoms which I mentioned earlier, that if you are noticing anything unusual outside your normal routine, then you should bring it to the attention of your medical gastroenterologist. When should one be worried about IBS? As I mentioned already, IBS, there is no disease inside. So I don't expect you to be losing weight, passing blood, or changes in your blood test. So if you are having symptoms of recurrent bleeding, passing fresh blood, or passing black motions, if you're losing weight without trying, if your general health is going downhill, if there are blood tests that are all abnormal, if you have got persistent pain, or if your symptoms are gradually getting worse and you feel that something is not quite normal for you, then you should seek the advice of medical gastroenterologist. Foods that can trigger IBS: milk, which has got natural sugar called lactose that can cause a lot of bloating and gas in people with IBS. And there is a lot of people with some degree of lactose intolerance. They may be able to tolerate milk products like curd, buttermilk, and paneer. And if your diet is rich with legumes and lentils, especially rajma, chickpeas, kidney beans, it might be a good idea to cut it down. Cruciferous vegetables like broccoli, sprouts, these cabbage, cauliflower can produce more intestinal gas and worsen the symptoms of IBS. If you're consuming fruits that have got high amount of natural sugar like mangoes, eating watermelon regularly, or grapes, this can also worsen the symptoms of IBS. If your diet has got a lot of grease or fat in the foods where the body is taking more time to process, this can also worsen the symptoms of this bloating and heaviness. Cut down on the coffee and tea intake, especially if you're consuming more than 2 cups in a day. If you are a smoker, it is always a good idea to quit. How to fix IBS at home? Well, it is important to ensure that you are getting adequate exercise. So 30 to 45 minutes of exercise at least 5 days out of the week will help improve your digestive health. It helps improve your sleep, and it also has an overall positive effect on your mental health. If you're somebody who is prone to a very stressful work or personal life, you need to find ways of de-stressing yourself, whether it is yoga, meditation, or some sort of activities that helps you de-stress. You need to follow a fixed pattern of meals, and having a disciplined bedtime is important. Quitting smoking and avoiding alcohol regularly is also vital. If you are not hydrating yourself properly, this can also be making things worse for you. So it is important to ensure that you drink about 3 liters of water on a daily basis. Avoid any trigger foods. For example, if you are taking certain foods that trigger your bloating and abdominal discomfort, try and keep a food diary and see if you can cut it down or completely eliminate it. Try and avoid overeating, because it can kind of put more pressure on the digestive system and worsen your symptoms of the bloating and the post-food heaviness. So these are all the things that you can kind of alter in your lifestyle to try and help improve the symptoms of IBS. To get some relief in terms of the bloating, which tends to be a common issue, you can use simple remedies like lukewarm water with some ginger, lukewarm water with jeera or ajwain. These are simple remedies that you can use on a regular basis.